Hi, everyone. Welcome back to the Mind Body Couple podcast. Today, I'm here with Dr. Kenael Segal, and she is a Jamaican-born human being currently living in the United States in New Jersey with her family. She is a yoga and meditation teacher, Pilates instructor, physical therapist, and wellness enthusiast. As a highly sensitive person, she is passionate about promoting social change through radical self love, deep rest, compassion, and joy. Dr. Siegel is the owner of Lotus Physical Therapy and Wellness, a pelvic floor clinic and wellness studio. She empowers individuals with knowledge and skills to not just recover from physical limitations and dysfunction, but heal and thrive in their bodies. So, thank you so much for being here with us.
Thank you.
So, for the listeners, so they know, my partner Anne's not with us today, um, but we're very excited to be interviewing you on our podcast.
Thank you. I'm excited to have this conversation.
Yeah, and even reading that introduction, there's a lot of different areas you're working in and focusing on, which is amazing.
Yes, but there's a lot to me.
Yeah, yeah, complex, I like it. So, I really wanna dive into asking some questions and really learning about the work that you do and your approach and what that looks like.
Mhm.
If you're comfortable, sharing at the beginning how you really got into treating pelvic pain using more of a mind body approach. Like how that did that develop for you?
It was over time. It was a process. I recognized that the typical traditional physical therapy way just wasn't quite helpful. It wasn't very useful. It was more techniques about how to manage, and there
Mhm.
was not much discussion or talk about can this go away? The chronic conditions, right? Can it go away? It was more of like, here's how to help them deal with their pain because they're going to have it forever. Here's how to help them deal with this because they're going to have it forever. It's really just getting them to understand and accept that this is your life now. Here's what to do about it.
Yeah.
And I was having people coming back when I worked with them, when I would introduce like meditation or breathing or just mindfulness,
Mhm.
where it wasn't just, "I have pain, but I feel better about it." It was, "I don't have pain anymore." And it was like, "Oh, how'd that happen?" Like, what happened there? And then it was just more my curiosity of, what happened there and why did it work? And can we do more of that? And can we get it to stay away longer? And then
Mhm.
what's really behind the pain? What's really driving it?" And then I also started to recognize that some of these patients had a lot of trauma or high stress lives, and that could have been a contributing factor to that. And I just got curious and I would try this and try that, and it seemed to work. So I just kept going with it.
Amazing. Yeah. Yeah, and it's fascinating how that kind of developed for you because it's true, like in the typical medical system, like it's not something that's really promoted that
Right.
you can use more of this mind body approach, whether it's breathing or somatic practices or trauma work, whatever it might be, and then it can actually have a real impact not just on your emotional well-being but on the physical sensations that you're kind of having.
Right.
Yeah. And so in your approach, like tell me a bit about this. Like what does your approach kind of entail when you're working with people?
Right. So I am a listener, right? So I listen to people, and I'm a believer in the fact that people might tell you what they need subconsciously and not even be aware of it consciously themselves. So I'm listening for that. What is it that they need? What is it that may have brought this on? And then I'm sort of trying to like pull that out further and then address those things. So
Mhm.
if it's stress, like a high stressful life, then we may talk about, okay, how are you managing stress? Are you doing anything for yourself? Are you taking walks? Like, what is it that you enjoy? If they say they love doing art or taking walks or hiking, then
Mhm.
I'm instructing them or recommending them to do more of that just to see what happens. If they're a creative person, then I may encourage them to, why don't you take an art class or creative writing, or just write on your own or paint or something on your own, and again, seeing what happens. Like, curiosity is a really big thing for me. Like, what happens if you do this? What happens if you do that? What happens if you don't do this or you don't do that? Then what happens, right? And does it change your symptoms? And if it is changing how you feel, what does that say? And let's go with it.
Yeah. Yeah, and I like the curiosity and, like, exploring because it's so important because people come to a mind-body approach in different ways, and have different beliefs of what work and what doesn't work, and there's lots of great strategies out there, of course, but a lot of this, it's unique. It's individual person to person, as you're saying, right?
Right.
Of what works for someone and what doesn't work for someone. And unless there's that kind of exploration, we don't really know what someone needs to actually heal.
Yeah, which is why sometimes I feel like it's so difficult for me to really verbalize, like, what am I doing? What techniques am I doing? Because it is so individual. It's based
Mhm.
on the person, it's based on their needs, what makes them feel safe, what makes them feel loved and heard, or whatever it is that they need. It's really very individual based. And even when I was doing more traditional typical physical therapy kind of work, even the way that I practiced then was still very individual. Everyone didn't get these same exercises or the same manual therapy technique. It was very, what does this person need right now?
Yeah. Yeah. And I think that's a huge place where what I'm thinking about where people kind of get caught is they try to replicate just doing the same things or
Yes,
the things that they've been told to do instead of exploring, what their body, what their nervous system is actually desiring or needing in a
right.
given moment.
Yeah, and to me, a nervous system is as unique as our fingerprints, right? Like, we each have a different fingerprint. Our nervous system is as unique, and each nervous system has different needs. So it's really just about, as best as possible, right? It's not perfect, but as best as you possibly can, really about figuring out, what is it that my nervous system needs? And if you're the provider, what is it that this person's nervous system is needing right now?
Yeah. Yeah, and I like that each person's nervous system is unique. I want to say that again because people need to understand this. Of course, we have somewhat the same system, but you have to understand, right, as you're saying, that every person's nervous system is developed based on like their biology, every single moment in their entire life, their relationships, their internal relationships, their external environment. Like there's so many factors that cause someone's nervous system to develop a certain way. And
Mhm.
then depending what they need, like what actually creates safety for them or what actually sends kind of signals of danger for them.
Yeah, it's so unique, and we even know for a fact that people who experience the same thing, right? Like, 2 kids that grow up in the same exact home may have a totally different relationship with their
Mhm.
parents. Like, one of them, they're like, "I parents provided me with everything I needed. I feel safe and loved." And another child may have a totally different, like, perception of that, even though they grew up in the same environment. And that's because our nervous systems are so unique and so different, and so many factors go into what makes our nervous system ours.
Exactly. Yeah. Yeah, which leads into understanding why everyone's healing is very unique in what works for them.
Absolutely.
Um, and I know you mainly focus in on pelvic pain, if I understand correctly. And when we talk about pelvic pain, on our podcast and YouTube channel, I know there's a lot of terms out there for mind body pain. We use the term neuroplastic pain, right? Meaning that, the brain and nervous system is really perpetuating this. And so when we talk about pelvic pain, like how often do you find that people need a mind body approach for recovery to take place? Like how often do you find, and I know this is a hard question, that pelvic pain can be neuroplastic or this mind body issue?
Quite a bit, actually. I do find that a lot of the conditions that I'm treating related to pelvic pain, whether it's vulvodynia or vestibulodynia, which is pain in the very specific region around the vulva or the
Mm,
vagina area. Um, or if it's like treating men where they have like penile pain or scrotum pain or
mm,
pain in their anus, like that is a sign of neuroplastic pain as well. But even things that may be considered more medical, right? Like endometriosis or PCOS, or interstitial cystitis, like there's neuroplastic there's neuroplastic pain involved in that as well, or can be categorized as neuroplastic pain, even if there's a mechanical or actual physical reason for the pain being there, right? Like endometriosis or PCOS, right? There's still the nervous system's way of responding to that. And there's still emotions and there's still fear and there's still a story associated with that, mechanical pain or not. Like there's still emotions attached to it, and there's still a story attached to it, and there may still be trauma attached to it as well. So, not saying that someone's PCOS or endometriosis or penile pain or vestibulodynia is simply because their brain did it that way, but pain perception is coming from the brain, and whether there was an actual injury or not, the brain does interpret that continuously if that continues, if the pain does continue. So there may have been an injury initially why the pain first occurred, but the fact that it continues to occur, that's neuroplastic. The stories, the emotions that come up as a result of that, that's neuroplastic as well. And I say that as someone who's has PCOS and undiagnosed
mhm.
endometriosis, right? There's emotions and story and trauma attached to the pain. It's there.
Yeah, yeah, and I think that's so important for people to understand because I think people see it as all or nothing some of the
Right,
time, and we know that's not the case. That's not how pain necessarily functions.
right,
And you're right, like story, thoughts, beliefs, um, the level of emotions or fear surrounding the sensations themselves. If people were in this kind of survival state in their nervous system, um, like we can't separate that out from why pain's being produced, regardless of what diagnosis someone's been given. There's a reason that it's being perpetuated.
right.
I even think of myself as you were talking, right? Like when my pain first came on, like it was in my right knee, and I knew I injured it because there was swelling, like it was swollen after I ran.
Mm,
That probably healed within a week, but then it just perpetuated on forward. And so it's important to understand that there might be something that sparks it, like an injury or a condition, but then everything else is why it's kind of perpetuating on forward or worsening, week by week or year by year for someone.
right, exactly. And I think that's where people get tripped up is. And when they say, "You've heard it," I've heard it where people say, "But I've had an injury. Mine is different. Mine isn't neuroplastic. I did have an injury." Yeah, years ago, the body heals. It did, but the nervous system did not quite heal. Right?
Yeah.
It's still traumatized. There's still story behind it that the nervous system remembers, that the body remembers, right? And the body keeps a score. That's why they say that, because the body continues to remember. I've had people years postpartum who have experienced or suffered a tear during birth years ago, and they still have pain with intercourse. The body healed that, right? The scar it's healed, the
Yeah.
tissues are soft, we've done physical therapy, but it's the emotions and the anxiety around the body remembering, "Ooh, don't put that there. Last time something came through here, there was an injury and it hurt me," and the body's protecting itself. That is neuroplastic.
Yeah. Yeah. And it's kind of this protective mechanism that takes place that benefits us in so many ways in lots of different areas. It just
Yeah,
doesn't when it comes to chronic pain and symptoms. That
correct.
there's this kind of protective mechanism that's as you say, that's your body's job. That's what it's trying to do. That's what your brain, nervous system, body is all trying to do. They're trying to work together to best protect someone.
Yeah.
Um, and I think, yeah, just that understanding, because you're right, that does trip people up. If there was some physical finding or injury at the beginning, then they completely write off anything on this side of the work that doesn't make sense. You see this with I see this a lot even with like back injuries, right? Where someone pulled a muscle in their back and that was 20 years ago, but they're still having symptoms. It's like there's no major findings that are resulting from this. It's just, the brain remembers it. It created all this emotion around it. And I think the other thing you mentioned is sometimes when symptoms come on, we can have this kind of trauma response to it. It can feel incredibly overwhelming to our nervous system that we're having these sensations that are unpleasant. People are kind of doing medical test after medical test and nothing's being found. Like, it's really normal for us as human beings to have this kind of trauma response to sensations that aren't getting better or potentially even getting worse.
Yeah, if we're not used to experiencing discomfort and discomfort is such a bad thing to experience, we're always going to have a trauma response. We're always going to have this fear response of something must be wrong. We think the worst automatically, where it may or may not be true, but it's a story in our minds that we tell ourselves. And we all fall victim to that. It's about recognizing, I did that thing. I created a story or I had a trauma response. And it's not to beat yourself up and be like, oh, I did that bad thing, right? I had these bad thoughts. It's recognizing, huh, I had those thoughts. Look at that response that I had. That was interesting. Maybe I can do differently next time if I catch it.
Yeah. Yeah. And I think you hit on a really important point there of the criticism that comes. Like, people start to understand this mind body world and they're like, oh, is this my fault? Like, that's instantly what happens.
Yeah,
Where if it was something physical, they're completely off the hook. But all of a sudden, if it's something to do with their brain, nervous system, emotions, trauma, then it's their fault. And that's not the case, right? As you're saying, like, this is natural. This is a natural way that we respond to physical sensations. But it's that awareness, as you're saying, the awareness of like, okay, I responded this way. How can I shift that in the future when this comes up? Um,
absolutely.
like when a pain, yeah, go
I was
ahead.
gonna say, I think that's one of the reasons why people get really defensive when they're told that, "Oh, this is a mind-body thing or neuroplastic or it's the brain," right? Or they get really defensive about it because they're like, "I'm not doing this. I didn't cause my back pain to hurt. I didn't do," it's all about they feel very defensive because they feel like they did something wrong, where it's like, "No one said you did anything wrong. Your nervous system responded reflexively." What about that is wrong? There's nothing wrong about your
Yeah,
body, your nervous system doing what it's built and made to do. It's just about being aware of it, like we said before.
yeah, yeah, and I think that's so key because it's that blame that really makes people defensive, which you've probably experienced in your work as I have, where people are never willing to even open up this side of things or even consider that they're there, because then all of a sudden, for some reason, they're to blame for it.
Right. They feel really bad.
Yeah, and as we know, you're not to blame. You're not to blame for this. And I think something you touched on too is, the factors that can cause chronic pain, chronic symptoms, chronic pelvic pain. It's not just one factor often. Like, yeah, maybe an injury happened or something took place. But as you had said earlier in this interview, like, there's all these different factors that led up to that, right? There's trauma, childhood adversity, the way you respond to emotions, a lifestyle that perpetuates kind of this survival energy. Like, it's all propelling things forward. And we understand this with mental health. And I think there's been lots of campaigns to help people understand, like, hey, you're not to blame for your mental health, right? Like, there's all these factors. Now we can do things to start to work with it and change things. But I think that attitude needs to be applied here as well, where it's like, you're not to blame for these symptoms being perpetuated in your body.
Exactly.
Yeah.
Totally.
So, speaking of the many areas you work in, I have a lot of questions here. You talk about meditation and yoga. I know movement is a big thing you focus on. And I'm just wondering, what can you tell people about how these different modalities, these different practices can be useful for them? Like whether it's meditation, yoga, movement, like how do these things actually benefit people when they're healing kind of in this mind body lens?
Right. So let's start with meditation.
Yeah.
Meditation is just a way of quieting and calming the nervous system, right? If someone is in acute pain or just like debilitating pain, the last thing they want to be told is go sit and meditate and calm down, right? But the more we can practice feeling calm and quiet in our bodies, minds, spirits, our whole entire like nervous system, the calmer and quieter the pain, the sensation, everything will feel. But that is not even step one, right? We that's the end goal. The end goal is wanting the nervous system to be more calm, to be more quiet. To get there, some people need to start with movement, right? So, exercise is a way of, for me, I look at it as tiring out and fatiguing the nervous system so that it has no choice but to quiet down. Then you can meditate.
Yeah.
And yoga is the combination of the 2. You're moving in a way where you're very mindful of your movement. What am I moving? How does it feel to move? What is other parts of my body doing? It's really like connecting your mind to your body, like bringing in all your senses, all your awareness to notice how you're moving, the quality of the movement, all without judgment, right? The quality of that movement, breathing at the same time and quieting and calming the nervous system because you're so focused on how you move in your body. You can't be focused on anything else. And your our nervous system is complex, but it's also very basic. We can't focus on 2 things at the same time. Either you're focused on your pain and your misery, or you're focused on your movement and your breathing, right? It's one or the other. So we can exercise, fatigue the nervous system, and then try to like calm down the nervous system some more through meditation. We can be mindfully moving through exercise practices or other movement practices like yoga, and then move more into a meditation. But the whole goal of any of that is to practice being in a more parasympathetic nervous system tone
Mhm.
or dominance versus the sympathetic, which is the fight or flight, where things get real panicky and there's anxiety and all the things we don't like happen during that. And it's
Mhm.
not that the sympathetic nervous system is bad, it's great when there's something actually happening that needs our focus and attention and we need to fight or flight or freeze, right? Those do come in handy, but the problem is we end up staying in that condition a little bit too long over the course of the day and we never come back down to parasympathetic where we're supposed to be pretty much most of the time.
Yeah. Yeah, and I think this is such an important, well, you said so many things that are vital. And we talk about our society, our culture, a lot of people with kind of these neuroplastic pain or symptoms, they're in this constant sympathetic fight, flight, irritated, anxious, nervous, rageful, like they're constantly in this zone. And like you said, like being mobilized sometimes is great. It can be really useful, but there is this downside, as we know, that it can perpetuate our symptoms. And
Correct.
you're right, like all these different ways. And when I was reading your bio before this, that's what I appreciate about this is there's so many different areas that you're doing, like different ways that you're getting people to that parasympathetic, calm, connected, kind of safe at ease zone. Because it's a little bit different, as we were saying, like everyone's nervous system's unique,
Yeah.
and what works for them um, is going to vary, and that's why that exploration of different things. And it's hard because the problem with movement is when we have chronic pain, that's the first thing to go for a lot
Yeah.
of people.
Makes
It's
sense.
like that's it. Like that's it. Like when I was in chronic pain, that was the first thing that I started to be like, movement's bad. So I stopped moving and then became incredibly dysregulated as a
Right.
result. because it's that movement, well-being in that parasympathetic zone that is so vital. Whether you talk about yoga or meditation or various practices, it's so important that we get back there. And I think that's a key ingredient for people's healing is there needs to be movement. If we just avoid movement altogether, it's really hard for our nervous system to ever feel in this calm, connected, safe zone.
Right. We're made to move, and people forget that. And yes, I get it. When you experience chronic pain, you said it. The first thing you did was, well, not moving because it doesn't feel safe to move anymore. But when you can move in a way that feels safe, that's just confirmation to your body of, oh, I can move in a way that feels safe. And the more you do that, the more safe your body will feel, the more your nervous system will begin to now regulate and go, "Oh, okay, it's not so dangerous out here. I can calm down now." And it will
Yeah.
eventually.
Yeah, and that's so key because I think something that people really lock onto in a mind body approach is, and I was thinking about this the other day, people really like the cognitive messages of safety, right? Like, and there's nothing wrong with that. They're important. Like changing your thoughts, beliefs, giving your cognitive messages of safety about your body is an important element of healing chronic pain and symptoms. But the other thing that you're kind of talking about is these like somatic messages of safety that we need to send to our brain and nervous system. And one of the ways we do that when we've been in chronic pain and basically in stillness, constantly not moving, is you actually start to approach mindfully this movement because that's a way that our brain gets these messages of safety, from the body. Yeah.
Yeah, totally. I mean, if we're not moving, if we're feeling this constant, fight, flight, or freeze sensations or symptoms, we're experiencing that, right? Let's look at the fight, right? Like your body wants to fight things off, right? And if you're like, no, it's scary to move, you're going against what your body wants to do. So, like one thing I do with myself and my family, I have three small children. I will tell them if you get so angry that you feel like there's energy in your hands and you want to like do something with it in a safe way that's not going to hurt yourself or anyone else. We have a giant bean bag and I'm like, go punch the bean bag. But don't hurt your hand. Like it's not going to hurt their hands, right? But I'm
Yeah.
like, go punch the bean bag or like go outside and like pull weeds, like do something with your hands, right? If it's your feet that want to move, go outside and run, go kick some leaves, go do something to get that energy out of your body, right? So we have to move that energy out of our body. But then when we look at the freeze, like our body wants to shut down, moving, doing the opposite of that is showing your nervous system it's okay to move. You don't have to be in this free state. Look, you're moving and nothing bad is happening, right? It's again confirmation that you're safe. You can get this out of your body. You're safe. It's okay.
Yeah. Yeah, and I think this is so important because what will happen to people is they feel emotions, they feel dysregulation, and they feel like they need to process them by just sitting still, never moving. Like, you know what I mean? Like, this is how people are taught, but that's not how our nervous system wants to process things.
Yeah.
Whether you're in fight, flight, freeze, shutdown, like movement is a really important element to that. And I don't want to discredit like stillness can be important as well, depending on where we're at.
Yeah.
But I I was smiling there because I tell my son who's 6, I tell him to do the same thing. Like he goes and like, he just punches his bed or throws his stuffed animals. Like, similar to you, like I'm trying to teach, like, allow yourself to feel that energy, be present with it, and allow your body to move.
Mhm.
And that's why it's so key to regulation is, as people start to recover from chronic pain and symptoms and they start to move their body more, it all starts to perpetuate themselves forward in this kind of safety cycle, right? Where their brain and nervous system is getting messages from the body like, hey, we're safe. And it's getting messages from the body of like an allowance of moving our body to process emotions and kind of that survival kind of energy that we feel.
Yeah. And
Yeah.
then one thing I recommend to people is like find what works for you. Like I choose to do that with yoga, with meditation, with Pilates, but someone else might want to go do like really heavy lifting, or they may run, or they want to dance, or they want to do kickboxing, like something. Find a way that works for you. Find something that works for you. There's something out there for everybody. It's just about
Exactly.
finding it.
Yeah, it just makes that, as you talked about at the beginning of this interview, that curiosity and exploration of
Yes.
trying different things and noticing what's the response in your nervous system as you do this.
Yes, exactly.
Um, and then people can find this package that really does help create, you know, for their unique nervous system, this kind of regulated package of things that they can do. So, I also want to spend some time at the end here. Just if you could share with the listeners, the different programs you offer and how they can go about working with you.
Right. So I do in person and virtual. So people who are local to the New Jersey area, I will see people in person, but I also do virtual as well. So my virtual for people outside of New Jersey looks more like coaching. So it may be an exploration where we find out what's going on with their nervous system. Where do they feel off? Why doesn't it feel safe? What do they need in order to feel safe? And then coming up with the package, as you mentioned, like what are the package of things that this nervous system needs? And then doing it. And then my job really is to like guide and support. Whether I work with people in person or virtually, whether it's physical therapy or coaching, it's really just finding out what the individual needs and then supporting them through that. Because if they were doing that before, they wouldn't be in the situation that they're in. So, my job isn't to do the things for people, it's really to teach them what they need, pulling out, based on speaking with them, what is it that they need best, and then offering up that to them like, okay, hey, I think this is what you might need. Or you mentioned that you used to dance back in the day. Maybe try dancing now. It's really just about teaching them how to is part of what I do is to help people not just recover from their symptoms but thrive in their bodies. Like how can they be their most authentic self? And when you are living your most authentic life, you are in alignment with things. There's less stress. Things don't bother you as much because you are content, right? You are content with everything and you are aware and you are present. And not to say that
Yeah.
life is always good and dandy, right? Like things do come up, but you just handle it better. So when stress does come up, instead of spiraling out of control, they're like, "Oh, okay. I have some tools to get through this as best as I possibly can." Because life isn't about let's be happy 100% of the time. We're going to have challenges. And it's really just about, okay, do I have the tools to be able to get through this as smoothly as possible? And
Mhm.
that's really what I'm teaching people to do is how to be their most authentic self, how to find what works for them and develop their own what I call their self-care routine. Because
Yes.
we gotta take care of ourselves. We are the most important people in our lives, and if we are not healthy and well, the people who we are caring for, we're doing a disservice to them and ourselves as well. So, yeah. And if someone does want to work with me, they can reach out to me via my website, which is my name, drkenaelsegal.com. I'm also on Instagram at Lotus Pelvic PT. And I have a podcast, Beyond the Pelvis, and I think that's where I am everywhere.
I like it. Well, I will put all the links in the description below so people can easily access them. But again, thank you so much for being on the podcast. I really appreciate it. And I appreciate you sharing your wisdom with everyone.
Thank you. I appreciate being with you.
Yes. And thank you, everyone, for listening. And I will talk to you next week.